Hello everybody, welcome to another episode of DOCTALK. My name is Dr. Michael Bracchio at Velocity Sports Rehab, and in this episode we're going to go over tennis elbow. Tennis elbow is also called lateral epicondylitis. What it is it's actually a tendinopathy on the outside of the elbow. So the muscles typically involved are the extensor carpi radialis brevis, but the extensor carpi radialis longus and the extensor digitorum can also be involved. All three of those muscles attach on the outside of the elbow and either extend the wrists or extend the fingers. While the name tennis elbow implies that only tennis players would suffer from this, it's actually fairly common in the general public as well. We commonly see lateral epicondylitis in a lot of weightlifters, people who are lifting either barbells or kettlebells because it requires a lot of gripping. Other populations that are at risk for developing a lateral epicondylitis are anyone really who uses their hands a lot. So for example, butchers, carpenters, even serving tables, they're all at risk for developing a tennis elbow just because they're using their wrists a lot and having to support a lot of load. In the treatment of tennis elbow, the first thing we're going to look at is how much load we're putting on the wrist extensors. Typically when we're looking at load, we're looking at an overloading of those wrist extensors, so we're going to decrease the load. So if we're dealing with a weightlifter, we're going to decrease the amount of gripping activities that you're going to have to do, and we're also going to decrease the amount of weight. If the pain doesn't seem to be going away on its own, there are a couple treatment strategies we can try. The first thing we would try is trying a rehab protocol to help stimulate and build the tissue capacity of the wrist extensors. So first we'd start off with an isometric hold, which just means, usually with a band, just holding our wrist against some resistance. Once we were able to tolerate some isometric loading, then we'd progress into some concentric and eccentric loading, which just means flexing and extending the wrist against some resistance, again, most likely with a band. To help make the loading program a little bit more comfortable, we can add in some manual therapy or some joint mobilizations as well. Manual therapy would include doing some pin and stretch over the extensor muscles, or we could also use Graston, which is the little metal instrument used to help desensitize the movement. Corticosteroid injections were once a popular treatment option for tennis elbow. This was when we thought that inflammation was the cause of tennis elbow. However, research has shown that while corticosteroid injections have a good short-term benefit of decreasing the pain, they actually have a long-term cost, which is an increased recurrence rate. The research has shown that exercise and mobilization are actually more beneficial in the long term than corticosteroid injections. This makes sense because you're trying to build tissue capacity in the wrist extensors, which corticosteroid injections have never been shown to be able to do. Thank you guys for tuning in to another episode of DOCTALK. If there's a topic that you guys would like us to cover, let us know in the comments below. And if you thought this video was helpful, don't forget to like and subscribe to this video.